Someone asked me how to handle a difficult patient. So I'm going to answer this question in detail. And I think as a healthcare worker, whether you are a nurse, doctor, or a support worker, you need to know how to handle a difficult patient, how to handle a angry patient, because situation can arise anytime and you may be there to handle the situation. So if you're interested in this topic, please watch the video till the end, and we are going to discuss each and every bit about angry patient, how we can handle the situation nicely and in an efficient way. If you haven't met me before, I am SaimA Uk. I'm a nurse from Pakistan. I'm practicing here in the UK as a nurse, and if you haven't subscribed this channel, I provide information about UK nursing, process of becoming a nurse, each and every bit around me, and lifestyle of a nurse here in the UK. If you haven't subscribed, what are you waiting for? If you are a returning viewer, please, thank you so much for watching and for your support. I would like to say a big thank you. You guys are always there to help me and support. I really appreciate your efforts. So let's get into the video without any further delay. If we talk about angry patient, we need to know the root cause of the patient being angry. Why is the patient angry? What is the reason behind it? There can be many reasons. There can be a situation where we left the patient for a long time in a waiting area, or we made any mistake. There was any mistake by the medical or surgical team. Was there any delay in the treatment? Whether the patient got any bad news, or if there is any problem they are facing in the ward or in the ICU or wherever the patient is, or we haven't met the expectations, and this can lead to patient being very angry. Anger can also exacerbate if they have any anger management issues, or if they are alcoholic, if they drink a lot, or if they have any mental health problem. We need to take into consideration before we talk to the patient. We need to know if whether patient has any mental health problem, or if they are drunk, or if they are struggling anything like physically, if they have any problem physically or mentally. The first point we need to know is how we would know that patient is angry. Patient can display their behavior in many ways, especially if they are loud, they are swearing, they are shouting, or if there is they are walking in the corridor continuously, or they don't want to talk, or they don't want to sit down, or they are very sensitive about something, or they are behaving like oversensitive, or they're aggressive, or they're behaving like a aggressive person. Even he's saying yeah. So if their posture is like very aggressive, or they are shouting, swearing, these are the behaviors which shows patient is angry. Sometimes they won't like to respond to you if they are angry, or if they are shaking also, because me, when I get angry, I shake and I don't want to talk to anybody. So if shaking is there, that's also a sign of anger. And also I wrote it down because sometimes it gets difficult for me to explain when I'm in front of camera. So these are the behavior can show anger. So how are we going to handle the difficult patient? What is the first step? The first thing, if we see a patient is angry or a relative is angry, as a healthcare support worker, whether you're a nurse or a doctor, the first thing you have to do is acknowledge their anger. Acknowledge that they are angry. All right, you need to recognize their anger and tell them that I can see that you're very angry. Can we talk about it? What is bothering you? What is the problem? All right, you can take them to a private room or to a side room and ask them, can we talk for a moment? What is the reason? We need to find a root cause of them being angry. All right, it is very important that you recognize that, you show that you care for them, and you know that they are being angry, you know that they are behaving differently, you are noticing any difference. Okay, as a nurse or as a healthcare support worker, you need to know these things, because if you don't notice, if you don't care, it shows that you are neglecting them. All right, when we identify that patient is angry, when we recognize that patient is angry, then only we can respond them accordingly. Then only we would know what is the reason. Then only we can decide how to talk to them. Right, some people, when they are angry, they don't make direct eye contact. So you need to know that also. If they're not making eye contact with you, maybe there is some problem. All right. right? So the first thing we need to know is how we are going to talk to that patient. What is our way of communication with that patient, because our communication is very, very important. So in communication, we need to notice about our voice, what tone we are using, what is volume, what is our volume and speed that we are talking. So our tone should be calm, low pitched tone, and also our volume should be low also when we are talking to that patient. And we should not raise our volume because it shows that we are shouting at them too. So if patient is angry, the first thing you need to know is calm down, relax. You need to talk to them in a lower voice, you need to talk to them in a calm way, and also like in slow voice, in slow tone, slow, your volume should be low, right? So the communication is very, very important. The next thing I have on my list is your body language. If you are sitting down, sit down nicely, like you can lean back a little bit just to show that you are paying attention to them, you are not ignoring them. All right, also you can, if you are crossing, if you have crossed your arms or legs, you can uncross them and pay attention to what you are saying, what they are saying. Listen attentively. Listening attentively is very, very important. So you need to pay close attention what they are saying. See, when he is saying, yeah, I'm saying right. So body language, sitting back slightly to present that you care for them. Try to understand why they are angry. Find the root cause, why they are behaving like that, what is the reason behind it. Was there any mistake from the staff? What was the reason of them being angry? Listen attentively. All right, make eye contact with them, listen to them, and then also you can make that sounds, you know, verbal responses like okay, all right, all right. So and then at the end you can summarize also. Let's say that patient said, I'm very angry because the nurse didn't give me the tablet on time. I'm fed up with this. I don't want to live here. I just want to leave the ward. So you can say that at the end, after listening attentively, and then to display that you understood it properly, you can repeat it. So what you are saying is you are upset because the nurse didn't give you tablet on time and you want to leave the ward. Is that right? Did I get it correctly? This is the way you can acknowledge that you got it right, what the patient is saying. Is lying down or sitting down, you need to give them some space. All right, don't interrupt when they are talking. Also you need to show empathy, acknowledge what they are saying, and say that you can apologize also. You can say, I'm so sorry that you felt that way, I'm so sorry that this has happened, and what we can do about it. At the end you can give some suggestion, ask for suggestion also from the patient side, because they can help you better to decide what they want at that point. They can give you a suggestion also, and it's always good to ask them what their advice is very, very important in giving the suggestion. Because if you are saying, can we do this, can we do that, and then you won't be able to, if you are not able to do that, they will feel it like I was just talking rubbish. So you need to ask their suggestion also, what they want and what the fix they want in that situation. So get their suggestion also. The most important thing you need to remember is, if the patient is angry, don't tell them that we are going to fix it quickly, or don't give them reassurance like a quick fix. Because sometimes in the NHS or in the hospital setting, things can delay, and then sometimes they are not in your control. So don't give them quick fix option, because you will put them in stress, you will put them in an anger situation again. So always reassure them, give them assurance that we are trying our best to sort out their problem, and we will try our best that this will not happen again. If something bad has happened, give them reassurance that it's not going to happen again, and I'll inform my colleagues, and I will escalate it to my manager as well. So you need to give them reassurance. It is very, very important. Be empathetic, also apologize, also give thanks, that tell them that thank you so much that you told me this, and that you're feeling this way. It was really good to know that you discuss it with me, and I'm going to escalate it to my manager as soon as possible, and we will try to find the solution for it. and how we can fix it, because fixing the problem is very, very important, and escalating to the managers is also very important. So in short, if you have angry patient, the first important reason for you is to listen very attentively, pay close attention, maintain open body language. All right, if you're crossing your legs or hands, it's not good. You need to maintain open body language and pay attention, and you can nod your head, that paying attention, saying that by nodding your head you can also displaying that you are paying attention and you are not ignoring them. And also you can always try to find out the reason why they are being upset. And also you need to maintain good communication skills in way of you need to speak to them very slowly, nicely, and your tone should not be high pitch, because high pitch means you are very upset, you are angry also. So these are the things we need to remember when we are talking to angry patient, and this is the only way we can calm them down. It's very important. You need to adjust. When we work as a healthcare workers, we should adjust our communication skills. We need to talk to them in a nicely way, and our communication skills should be very, very good, because as nurses, as healthcare support worker, this is our job. We are not there to make them angry, we are not there to make them frustrated or upset about anything. We are there to help them to sort out their problems, and we are there for them. So you need to help them as much as you can. And we get angry also if we are not getting what we want. If the hospital or the clinic or the surgery is not meeting our expectations, we get angry also. As patients, when you go in the hospital or in the surgery, imagine, put yourself in their shoes, how they're feeling. What happens when you go to the hospital as a patient? How do you feel if you are not getting what you want, or if there is delay in the treatment, or if there is any problem, or the nurse or the surgeon or someone made any mistake? How would you feel in that situation? So you need to think in that way, that you need to think in the situation, keeping it like you are the patient, putting yourself in the patient's shoes, thinking from their point of view. Then only you will be able to handle the situation very nicely. All right, this is the solution only to handle the angry patient. If you have any more queries, guys, let me know. I am always happy to answer your queries. My baby slept already. He wanted to sleep, that's why he was a bit cringy and crying. So I was ready, my tripod, my camera, everything was ready, and then he woke up. He was sleeping and he woke up, so I just took him. And if you have go back, we need to go back to the topic. So angry patient management, we have done it. If you have any queries, let me know in the comment section. I'll be more than happy to make any video for you guys. And thank you so much for your support, and I love answering your queries. Let me know if you have any problem, if you want to come to the UK, if you have any problems that you want to discuss about your visa processing or anything. To be honest, in the UK, I'll try my best to answer those queries if they are in my strength and capabilities. All right, so I'll see you soon in the next video. Take care. If you like this video, please give it a big thumbs up. You can share it with your friends also who can benefit from it. So thank you so much for watching. Take care. Bye bye. God bless.